Hey everybody, it's Manny Mustakakis again. Tonight I'm coming to you from my own basement. I just did a workout myself, and it got me to thinking about exercise and sedentary lifestyle in particular as another risk factor for heart disease. It's coming close to the end of February, which is Go Red for Women Month. And I want to take a few minutes to talk about exercise in general. It's a huge topic, obviously. I don't think I'll be able to cover everything in 5 minutes here. But sedentary lifestyle, exercise, obesity, it's all tied together. It's obviously all a big risk factor for heart disease. Obesity and lack of physical activity is a big risk factor for diabetes, which of course leads to other organ system failures. And in general, there's a ton of evidence that exercise is good for just about everything, not just your heart, of course. It does build up cardiovascular endurance. It helps lower blood pressure. It helps lessen your risk of a lot of different types of cancers. So exercise, we know, and it's not rocket science. We all know that exercise has always been good for you. But what types of exercise do you do? And what do I recommend for my patients, whether they've had heart attacks or heart failure or just people who are seeing me who've never had heart disease? There's all different types of exercise, of course. There's cardio, there's strength training, there's resistance training, there's yoga. It's all great. The answer in a nutshell is I usually tell most patients just do whatever you like. Whatever you're going to find interesting is what you're going to want to keep up with. For some people, that's just regular old walking. I tell people who've had heart attacks that you want to just get out and move. And even brisk walking 30 minutes a day, 4 or 5 days a week is more than enough. At least that's what the cardiology societies recommend. And so some people, I tell them, look, not everybody's an exerciser. Not everybody loves exercise, but if you can just get out and just walk, that's great. If you've just had a heart attack, we usually recommend that you don't do any strenuous physical activity for about 4 weeks afterward. But in general, you're going to talk to your doctor afterward and get back into an exercise routine or a rehab routine. What about besides walking? The great aerobic exercise is swimming. Swimming is fantastic because it's low impact on joints. And so people with arthritis, people with chronic pains, swimming is a great one for cardiovascular endurance. A lot of people like team sports, basketball, getting out and playing tennis, things like that. That's all great. Dancing, regular dancing even, is fantastic. Personally, I like to mix it up and do different things. I like to get out and run. A lot of people know that I'm into distance running and marathoning, and so I usually will run at least once a week if I'm not training for a race. I like to do yoga 1 day a week. And I like to do a lot of workouts at home because I just find it easier for me that way. So the bottom line is just do whatever works for you, whatever you have time for. I used to go to the gym. I don't go to the gym regularly at all anymore because now I just do it all at home in my basement. I like home DVD programs. I do, tonight I did an Insanity workout, but there's all different types of home fitness programs, whether it's strength training and weightlifting, whether it's push-ups and yoga and that type of stuff. But I like to do a mixture of resistance training and core training and cardio training. As far as weight loss, there is ample evidence that it's not just about cardio. Resistance training and core training plays a big role in kind of keeping your body guessing, if you will, for lack of a better term. And in terms of resistance training and core training helps to sort of get rid of a lot of the central obesity, a lot of the fat around your gut, which is important because it's not just your weight, but it's where that weight is distributed. Where is fat distributed? There's a big difference between having a big waist circumference where all the fat is sort of around your organs and in your gut, which is a higher risk for diabetes and a higher risk for heart disease, versus just being a big guy or a big woman who's just sort of dense or there's just kind of big all over. So the last minute, I'll talk about a little bit about why exercise is important, and you can't just diet alone. You can't just take medications. And this stems to what exercise does in terms of the physiology and the impact on your body. And so a lot of my patients will tell me, well, I take my cholesterol medicine, and I've had a heart attack. I take my cholesterol medicine. My cholesterol is going to be low. I don't really need to exercise. And that's not really true because what a lot of people don't understand is that there is a big difference between the different types of cholesterol, the different actual particle sizes. So we know that cholesterol is made up of big fluffy particles and small dense particles, and I don't want to turn it into a medical discussion as such, but I do want to emphasize this one point. And really, exercise, regular exercise, plays a big role in converting small, dense cholesterol into big, fluffy cholesterol. So even though the number that you get on a blood test may be the same, the relative particle size might be totally different. And so we know that the small, dense is what gets sort of deposited into the arteries of your heart and the rest of your body and causes plaque and hardening, and the big, fluffy tends to not. And so even though the cholesterol number might be lower from medication, exercise is really important in converting more to the big fluffy that doesn't tend to deposit in artery walls. So exercise is a huge component of cardiovascular health, and it's a huge component of weight loss. If you're trying to lose weight, it's really not enough to diet alone. You really need both. There's a saying that says that you can't out-exercise a bad diet, and that is true. But it's not just enough to diet. There really needs to be a focus on cardiovascular training, strength training, resistance training, and it all ties together in weight loss. As far as how I get it done, look, I recognize that everybody's busy. We all have busy lives and busy schedules. We've got jobs that are busy, commutes that are busy, families and kids that are pulling us in all directions. I basically do it by just setting an appointment with myself for the next day. I know, I usually get up and do it early in the morning. Today it just didn't happen that way because I was on call last night. But set an appointment with yourself and make sure that, you just have a plan. If you have a plan, you're more likely to be successful. If you're doing a type of exercise that you like, you're more likely to want to stick with it and be successful, because at the end of the day, we all rather do things that we enjoy. And so, like I said, find something that you like doing and make an appointment with yourself to do it. And if you don't love anything, then just get outside and walk around the block a few times, and that's a lot better than nothing. A little something, I always say, is a lot better than a whole lot of nothing. So I'm going to cut it off here. As always, I love to know where you guys are watching from. I appreciate you watching. I love that you guys get something out of this. I hope you get something out of this. And so comment with where you're watching from, what your exercise habits are for yourself, and if you have any questions about it. And I love engaging you guys, and have a great night. I hope you'll share with people who might be interested, who might get something out of this, people who may have had heart disease and have questions about exercise and where they should go from here as far as exercise is concerned. So thanks again for watching. Have a great night, everybody, and I'll talk to you guys soon.